Third, there is the situation, task, action, result, and reflection. So situation means you're describing the scenario, task is you're explaining your role, action is what steps did you take from your part, and result is what happened, and reflection is what did you learn. So we'll do that with an example. Okay, so suppose the question is, a junior doctor accidentally prescribes the wrong medication to a patient. The patient has already taken the medication. What would you do? Okay, so this is the question. So there is some medical error. So there is an ethical thing, prescribing the wrong medication, because the first thing in the ethical principles is to do no harm. Okay, non-maleficence. So we have breached that. Now there should be transparency between the patient and the doctor. So we have to communicate that effectively. So there are so many things happening in this situation. So in the STARR method, what is the situation? So as I'm answering the question, I'll say, as medical professional, patient safety is a top priority. In this case, a junior doctor has prescribed the wrong medication and the patient has already taken it. So I've took my stand and I've just mentioned the situation. So this is the situation now. Now explain your task, define your role. My responsibility is to ensure that the patient's well-being, address the error, and take steps to prevent further harm. So I have took my task and I have defined my role. My responsibility is first to ensure patient's well-being. You have to address the error and communicate and take further steps to prevent the harm. Like this should not happen again. So you have to take steps for that as well. Now next in the STARR method is your action. So explain what would you do in that situation. So you have to first, always it is patient centric. Our approach should be patient centric. So first assess the patient for any immediate adverse effect and inform the senior doctor. So I have communicated with the doctor chain and then I have to communicate with the patient bystanders. Next, I'd report the incident to the hospital patient safety team while ensuring the patient is monitored and supported. Transparency is crucial, so I'd communicate openly with the patient and their family, explaining what happened and what steps we are taking to manage the situation. So this can be, there can be a blurting of emotions, from the bystander side. There can be, they might not take it, very lightly. So you have to communicate very effectively, telling that this has happened, but we are managing that situation and the patient is stable. So you have to first make sure that the patient is stable. You have to communicate to the authority, to the drug safety team and all, and to the patient bystanders. Next in the STARR method is the result. So share the outcome. So you can say that by responding quickly and taking accountability, the patient would receive proper care and we would minimize harm. Reporting the error would also help improve protocols to prevent future mistakes. Okay, because that becomes our next concern. We don't want this mistake to be repeated again. So we will improve the protocols. We'll make sure that every time a drug is given to the patient, we confirm the patient identity, we confirm the drug, we confirm the route. Okay, because there is always a closed loop communication. So if you ask a nurse to give a drug, the nurse has to talk back to you. Okay, I'm giving this drug, this dose through this route. Especially in ACLS and all, we have learned that closed loop communication. Okay, next in the STARR method is reflection. That is, you have to show your personal and professional growth. What have you taken from this incident? So this situation highlights the importance of clear communication, teamwork, and non-punitive approach to medical errors. Learning from mistakes and promoting a culture of patient safety is crucial in healthcare. Now, this is a very written format. I don't want you to, we don't want to be talking like a machine. We can talk in our own tone and the conversational tone, but this is how it should be.